Here's a longer one, but I think it's important, as I said, that we get used to reading longer ones. I have highlighted in purple you can't highlight on a PowerPoint, so what I've had to resort to is the purple font, which I've bolded, to help you see the things that we need to be mindful of as we start to code this. The initial encounter will be important. That will be our 7th character for any S or T codes. And not just S or T, but primarily S or T. The cervical fracture, it is complete, meaning the spinal cord was completely severed at these 2 levels. I should have highlighted these 2 as well. Let's do that. C2-3, complete. It is a spinal cord injury. The patient is a quad. He's diagnosed with ventilator-associated pneumonia. Staphylococcus aureus is our cause, and it's methicillin susceptible. In this case, that spinal cord injury will be sequenced first, as it is the reason why the patient was admitted to the hospital. Either one of these 2 codes, the S14 codes, could be sequenced first. And as I mentioned earlier, the 7th character A is for the initial encounter. So here are the 2 spinal cord injuries, C2 and C3. Here's the quadriplegia, complete, C1 through 4 level, and the ventilator-associated pneumonia. When you go to the J95.81 code, you're going to see an instructional note, use additional code to identify the organism. So you're going to go to infection staphylococcal as a cause of disease classified elsewhere, aureus, methicillin susceptible, given as B95.61. I encourage you in things like this to cover up the answers and go here and look them up and see if you get them right when you're reviewing this particular slide, and any exercises really. It's wonderful for you to see my pathway and how I got there, but unless you've tried to do it yourself, it's probably not going to be very helpful. Here's an excerpt from a discharge summary. The 60-year-old male was admitted to the hospital with chest rails, dyspnea, cyanosis, and hypotension. He has severe GERD, gastroesophageal reflux, causing him to aspirate food. He was treated for his aspiration pneumonia with respiratory therapy and antibiotics. So my note to you is chest rails, dyspnea, cyanosis, and hypotension are all symptoms of aspiration pneumonia and are not assigned codes. The GERD that contributed to the condition should be coded. When I say GERD, I'm saying G-E-R-D. Let's put this in here. That is a very common diagnosis that you see in the hospital. So this would be our pathway. There's a code also note under this code that does not apply to us, and the GERD is here. When I give you information like this on a slide, that is something I can put on a test. I just want to be clear. Everyone knows that everything I show you in a PowerPoint is fair game for an exam, because I've given you study materials by creating these podcasts for you. So be sure you pay attention to them. Here's another exercise not in the coding handbook, because I noted the word pneumothorax and I wanted to talk about it a little bit. It's a pretty straightforward code when you get here, and this particular post-procedural code doesn't require that you identify the procedure. You may remember other codes where you had intraoperative cardiovascular surgery or some other kind of surgery. So this particular pneumothorax does not relate to any specific surgery. And I have here just a list of pneumothorax facts for you to understand what it is. In the medical world, it's just a collapsed lung, but what you need to know is that it can collapse on its own, which is spontaneous. It can collapse as a consequence of an injury, especially a chest injury, a car accident where someone is thrown through the windshield, or the steering wheel comes back on them and crushes their chest. Very common to see pneumothorax in those cases. A small pneumothorax can resolve on its own, but if you have a large portion of the lung that's collapsed, you're going to need some intervention. And typically you do see a chest tube placed in the emergency room to get some of that air, that free air, out of the chest cavity. The lungs cannot expand against all the air in the chest cavity, so they can't take a breath. So it's really important that that be treated very quickly, or it could be deadly. Here's a very long exercise, but again, I want you to get used to reading these longer ones. You're going to see them more and more in our coding handbook reviews and on the exams. Let me be clear about that. It's fair game on an exam that you're going to see a longer diagnostic or scenario that will allow you to use your skills to identify a main term and find the codes. This 87-year-old gentleman, Mr. Ronald Sidney, was admitted on 6/3/16 with COPD, with emphysema, CHF, HTN, and AFib. What do these mean? Chronic obstructive pulmonary disease, CHF, congestive heart failure, HTN, hypertension, AFib, atrial fibrillation. Very common for you to see these abbreviations on the medical record. You will not see a doctor typically spell these out. He has improved over the last 3 days and will be discharged home today to receive home health. HH is home health. Nursing and PT, PT is physical therapy. Through Centura Health, his O2 saturation has been maintained on 2 liters of oxygen throughout his hospitalization and will continue at home. He will need assistance with ADLs, activities of daily living, talk about that in a minute, until his strength returns. Scripts for all services have been forwarded to Centura Health. He will be followed by his primary care provider, Dr. Liston, where the family should make an appointment for next week. Discharge plans were discussed with the patient's daughter, Virginia Stacy, and she expressed an understanding. This is a very common, I wrote it, but it's very common to what you would see in a medical record when the physician is dictating a quick discharge summary prior to the patient going home. ADLs, activities of daily living, are dressing, feeding, toileting, things that we do every day that we're alive. We eat, we dress ourselves, we go to the bathroom, we can manage our clothing in the bathroom. Those are ADLs. I have here all of the pathways for you. I have in purple highlighted the main terms. Like when you see COPD with emphysema, emphysema is your main term, and the chronic obstructive are non-essential modifiers in that code description. Here's your heart failure. There is a code first, instructional note, heart failure due to hypertension. That does not apply to us here because the physician did not indicate a relationship between the heart failure, the CHF, and the hypertension. So we don't assume a relationship unless the doctor's told us that. Here's your hypertension, and here's the AFib. Again, I strongly encourage you, look through this one, highlight those main terms, see if you can find the codes, compare your answers to mine, and then look at the pathways. A coder reviewed the record of Mr. Simmons and noted the following. The patient was admitted with respiratory failure with hypoxia and a suspected MI. Further study confirmed he had sustained an MI involving the left anterior descending coronary artery. Based upon a thorough review of the documentation, the coder felt the two conditions were equally responsible for admission to the hospital. What are the codes, and what guideline helps the coder know what to do? Here's the codes, here's the pathways, and here's the coding guideline. This is section 2. Most of the time we're looking in section 1, but section 2 is selection of principal, and section 2C is when 2 or more diagnoses equally meet the definition for principal. And what the guideline tells us is the circumstances of the admission will help the coder determine the principal. If she finds that they're equally responsible, it would not be incorrect for her to choose either one of these codes as a principal. But I would want to be very clear that you've thoroughly reviewed the chart and you can say with conviction that either one could be equally possible as the principal diagnosis. Let's look at another pretty long one. The 32-year-old young woman was admitted for surgery to debride an infected left lower leg open wound originally sustained a month ago while hiking in Rocky Mountain National Park. This is a subsequent encounter. Treatments to date have not been successful to eradicate the gram-negative bacilli. An hour prior to surgery, she became hypoxic and eventually went into full respiratory failure. She was ventilator dependent for 6 days. She expired at that time. The cause of death has not been determined. I have highlighted in purple those words that will help you look at your main terms. It is a subsequent encounter, which is a 7th character D, as in David. We aren't told exactly what organism it is, but gram-negative bacilli does allow us to find a code. And then the respiratory failure, the cause of death, is coded. No, I'm sorry, that wasn't the cause of death. The respiratory failure, because she went into respiratory failure, is coded. We don't know the cause of her death. The guideline that applies in this case is original treatment plan not carried out. She came into the hospital for the leg wound. We don't think that's what killed her, but it doesn't matter. We code as principle the condition that occasioned the admission to the hospital, even though treatment may not have been carried out. So this case, that open leg wound, is what gets the principle. There is a code also in the associated wound infection. That's your A49.9 code, and then the respiratory failure code. As always, be mindful the exercises in the PowerPoint don't address all the guidelines. Exam questions can relate to all the guidelines covered in the chapters planned. Be sure you read all the guidelines each week so that you can really begin to bring to your memory a guideline. When you read a case or a scenario and you think, oh, I know there's a guideline about that, then you can go back and search for that guideline. But unless you've read them enough to remember there's a guideline, you're not going to have any luck with that. Always follow the assignment schedule with regard to specific chapter assignments. If you have any questions, please post them in discussion board along with the attempted path you have used to find the code, and I will be happy to help you. Thank you for your attention and have a good day.